Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Chain Drug Review. Today we're here to talk about Health Equity 3.0, the annual summit sponsored by Kearney and Chain Drug Review that looks at health disparities in the U.S. and ways to alleviate them. Today we're going to bring you the first of a series of highlights from the event. Rina Shah, Senior Vice President of Pharmacy Growth at Walgreens, was the keynote speaker. She started out by talking about how she perceived health equity as a problem even as a child when she observed her father's pharmacy practice.
I work at Walgreens. I've been with Walgreens for over 25 years. I am a pharmacist by training. My father owned a handful of pharmacies in the west side of Chicago here. So I grew up with pharmacy in my back pocket, but really health equity was instilled in me from back then. But when we think of health equity, it's not a new topic. You know, as I mentioned, this is something that I've even experienced when I was a young child. But when we think of health equity, when we look at how we drive health outcomes, you'd be surprised to know that really only 20% of someone's ability to improve their health outcomes comes from medication, treatment, any sort of medical intervention that can happen. And so all of us as health professionals, that maybe a pharmacist or a nurse or a physician, even innovating in pharmaceutical industry, it's all around the medication. But what we fail sometimes to realize is that 80% of the health outcomes that are out there they can be determined by your social determinants of health. In Chicago, the first stat is from the American Heart Association. When we look at the city of Chicago, if you just go out a couple of miles out, about just a 5 to 7 mile radius, there is a life expectancy shift by 20 years by just going 5 miles out of the radius that's here. Women are, despite having a longer life expectancy, spend 5% more of their life in poor health compared to men. I actually would say it's probably higher than 5%, but it's unacceptable. We have so much room for growth there. Pregnancy-related mortality rates are 2.6 times higher in Black women. Now, if we think about that, that's not something that we didn't know, but it's gotten dramatic. This stat was from years ago. It's gotten dramatically worse just in the last year with the shifts in Roe v. Wade. So what do we need to do that's different than what we've done in the past? COVID-19 was able to unmask the fact that any individual that is either of minority descent, is in an underserved community, there's about a 3 to 5 times more likelihood that they're going to have an unintended consequence from getting COVID-19 than anyone else. And so we have a lot of work to do. People might look at health equity as a CSR type initiative. You know, it's an advocacy event. It's nice to put on a report, on an employer report saying, great, we've done really great work with health equity. But if you look at your business, and if you want to drive proper outcomes, in addition to doing the right thing, for the right business principles, health equity is really a guiding compass when we look at how we want to drive this going forward. Because that's the only way healthcare organizations are going to be able to be effective in the long run. When we look at population health and being able to disrupt care, there's no way that even us at Walgreens or any other organizations that are out there are able to improve adherence to the level that we know we can without understanding the impact of health equity. Since 2020, there has been so much that was uncovered about the gaps in communities of care. So there needed to be a shift in reimbursement and how that comes to life. Ultimately, the STARS measures, Medicare plans that are out there, they get star ratings. It's kind of like Google ratings, right? You can get from 1 to 5 stars. Typically, the great health plans that are out there, that are Medicare plans that get paid from Medicare, are at the 5-star. So if you get to a 5-star Medicare plan, that means the patients that are in there, it's expected that they are healthier, that they have the right resources, that their customer service is incredible. And to get a 5-star, when you are a 5-star plan, you actually get paid more because you're doing the right thing. What's been incredible is in 2023, what CMS has come out with is a new health equity standard. Those health plans that help serve our underserved communities do a better job of managing chronic conditions with those patients are actually getting a bonus on their star ratings. And so if you're doing well on adherence across the board, and that was impacting your star ratings, if you're doing it with your underserved community, that's a triple star. So from a financial standpoint, now health plans are being evaluated on how well they're doing for patients that are in underserved communities. Now, what was a little painful when you read that, the entire CMS listing, is that pharmacy isn't listed. Pharmacist isn't listed. But that's okay, because everything that's listed in there is really talking to pharmacy. And of course, I'm extremely biased because I'm from Walgreens and I'm a pharmacist and I love pharmacy. But when you look at that, on the list of conditions that they actually are evaluating health plans for, it's colon cancer, it is diabetes, heart disease. It actually lists medication therapy management. Who does that? Pharmacy. What you see is the key pillars that CMS has established across the board. What are their goals that they're trying to achieve? The first is advancing equity, so really making sure that there is a need across the board to drive health equity. Expanding access, and that's where the payer relationship really comes to life. Engaging in partners. We cannot do it alone, and you'll hear this throughout the next couple of minutes, but that is just a mantra in general. There's no way we can address a long-standing problem for over 100 years alone, so engaging in innovation and partnerships. And then protecting the programs that do work. I'm so excited to say that 3 years ago, when we established a health equity task force, it was during the pandemic, we started looking at what would it take for us as an organization to start shifting the culture. But really the intent is that we know access to care is so incredibly important, that partnership, we cannot do it on our own, and education is so critical to everything we do. The amount of distrust that is out there across different communities of color, the amount of education we need internally within corporate America is out there because there's a lack of understanding of the impact and the value that health equity strategies bring to life, as well as the lack of understanding of even healthcare professionals of how you engage and how you deliver these types of programs. So education at the end of the day is how we actually bring it to life. And for us, it was around these 4 different areas. Social determinants of health, because we know that we're in communities across America, and we wanted to make sure that we include that in our data. That first row is all around data, being able to understand where we are, who we serve, what are the behaviors, the attributes of the individuals we're ultimately going after. Vaccination and testing, that's what we do all day, every day, is vaccination. We're in immunization season. Go to your local Walgreens and get vaccinated if you haven't already. Medication adherence and chronic care management, again, core to what we do every day, and really tailoring our programs around adherence. When I mentioned service design, we actually started redesigning all of our programs. We looked at how we deliver adherence programs, and why is it that the suburban communities that are primarily white saw higher adherence rates than communities of color? What was the difference there? It wasn't because the programs were like, if you asked us a couple of years ago, we were like, the programs are the same. It must be store execution, or it must be something else. Really what we ended up doing is we went back to the root and saying our program was designed incorrectly. We redesigned the program so that we can see better results with how we deliver adherence. We're offering solutions like nationwide same-day delivery. We're offering solutions so that when we know transportation's an issue, we offer solutions for cost savings because we know cost is an issue. We're connecting individuals to communities so when we know that there's potentially mistrust, and partnering with local churches, partnering with local officials so that we can ensure we're addressing the core issues. And then wellness and care, and making sure that we know that it's not just what's happening at pharmacy, but also what's happening in the front of store, vitamins and health and wellness merchandise, so that we can make sure we're supporting our patients across the board. And when we set our goals, they actually are not only internal goals. We look to the CDC, we look to the government. We're not taking only internal data. We're taking data externally, bringing that in and saying, okay, if there's a healthy people 2030 goal for immunizations, what are we doing to help influence that in a different way? At the end of the day, I'm asking each one of you to pivot your organization. This is not a a nice to have. This is not something that just is a CDC issue or a government issue. We are all in the healthcare profession. We're in this industry. And in order for us to be effective in this industry, we need to start shifting our approach around what we think health equity is. And so the first piece is, when you look back at your organization, making sure that there's internal alignment with senior leadership. At Walgreens, we're lucky because we have that alignment, but many of the case, if you had asked maybe 15 years ago, it might have not been the case. So putting together the business plan and making sure everyone understands the financial impact that health equity provides to an organization as they build their programs. The second is priority areas. It is so easy, when we first started down this path, it is so easy to boil an ocean here. So understanding what is core to your organization and how do these data values help really accelerate what your priority areas are. The third is leaning on your community partners. There is no way you would have seen those numbers, 400 million, 65 million, all the testing services. There's no way you can get to those numbers if you don't engage with community partnerships. And so having the ability of knowing who's in the community, establishing the relationship, doing the hard work of being able to be trusted, that is going to be critical to see success. And then strategically investing in resources. That is something that, every dollar matters. And so you want to make sure that you're investing the right way, where it's going to actually pay forward 2 to 3 times, because that is just going to be the gift that keeps on giving.
Please join us next week when we examine the issue of pharmacy and food deserts.